Welcome to Connecticut in Motion. Today's show, Transit and COVID-19, a fact-based discussion.
Good afternoon, everyone. I'm Dennis House, and welcome to Connecticut in Motion, where we will explore the future of Connecticut's transportation and the issues facing today's commuters at home and in the workplace. This series is a production of CT Rides, a program of the Connecticut Department of Transportation that works to find ways to get employees and other travelers out of their cars and use the more sustainable ways to travel in order to reduce traffic congestion and improve air quality. Today, we are going to address national, state, and local health impacts of the pandemic on public transportation. We will hear from Sam Schwartz. He's a national transportation expert who recently published a study on the relationship between using transit and the spread of COVID-19. Then, Dr. Ulysses Wu, an infectious disease specialist at Hartford Healthcare, also joins us to talk about the pandemic's impact on Connecticut. I've interviewed him many times. I always learn so much from him. And Rich Andreski, he is the Bureau Chief for Public Transportation at the State Department of Transportation. He's here to talk about the state's effort to make using transit safe during the pandemic. Now, let's get some facts about what is known about the relationship between COVID-19, according to a recent study on this matter. Please welcome Sam Schwartz. He is the CEO and founder of Sam Schwartz Consulting, with nearly 20 years in the New York City Department of Transportation as its chief engineer and first deputy commissioner. Today, Sam, you are going to be an expert on public transit. You're also the author of the report, Public Transit and COVID-19 Pandemic, Global Research and Best Practices. The report was commissioned by the North America's Trade Association for Transit Operators. It looks at the correlation between using transit and the spread of the virus. And Sam, I want to thank you for being with us here today. Great pleasure. And I'll pass it up to you to talk about some of these fascinating findings from the report. Sam?
Thank you, Dennis. For the past year, I've been pretty much immersed in COVID-19 and transportation, the impact on transportation systems, but also the relationship between the virus and infections on transit systems. This is a shot of Times Square last March 17th, St. Patrick's Day. It normally doesn't look like this, but we all know the impacts on transportation. The next slide will show you some of the impacts in terms of the numbers on transportation and who got hit the hardest. If this is a list in the New York metropolitan area in terms of how different modes of transportation were affected, from the most affected to the least affected, and the two columns are the peak in early and mid-April and the most recent, and we could see that airports, commuter rail got hit harder than other forms of transportation. Subways, of course, got hit very hard, but rail seems to have gotten hit the hardest in general transportation. And that's been sustained. And that may be because people using rail have greater car ownership than people who are relying on subways, and also have more options to work from home. We just don't know yet. In terms of car traffic may have dropped by 60% in the very beginning, and now it's down about 15 to 20%. In fact, in the late fall, it was close to normal levels. So you're probably seeing traffic congestion often on roads, although February and March are lighter than normal periods of time. Trucks did not get hit very hard, in fact, got hit the least. And we see trucks are pretty much at normal range, largely because we're ordering things at home. And other forms of transportation like bikes are actually at higher than normal levels. Next slide shows you some more local information in Connecticut compared to some national information. And we could see the same kind of pattern with rail, but statewide buses are doing better, and Connecticut fast track buses are doing better. Still heavy hits, but much better than even the national averages or the New York metro area that I showed you. But driving is up in the state of Connecticut, and you may be experiencing that. Nationally, driving is down by around 9%. One of the things that I want to point out is the inequity of our transportation systems and how we treated our heroes. In the beginning, we hailed them, the people that drove our buses or picked us up when we needed them and rescued us in the ambulances, or took care of us in stores, or tested us, or delivered our packages. We hailed them, wonderful heroes. But as the next slide shows, we then quickly discriminated against them with local and national policies discriminating against transit users. Even the New York Stock Exchange at first prohibited transit riders from trading floors. We see people are discounting parking fees. Even the CDC said, we'll give you more money for your employees that drive, and have them forget about carpooling, drive alone. And real estate firms and others have been perpetuating this. And then we cut service. The next slide will explain why. Why? Irresponsible research and reporting. And I've been working on this for nearly a year, looking at the sources. It started with a number of reports, pretty much the same, that said the subways seeded the massive coronavirus epidemic in New York City. And that's because New York City was first hit on the Eastern Seaboard. And what do we have different than other areas? We have the subway. But this was like saying ice cream causes drowning. If you look at the chart to the right, you could see both ice creams and drowning peak during the summertime. One can infer from that if you eat ice cream, you're likely to drown. This is an example given in Statistics 101 of the lurking variable. We both have summertime as the common variable over there. So we saw articles, and the media just jumped on it. The New York Times, are cars protecting Los Angeles? Because in Los Angeles, people hardly take transit, but they do drive a lot. But then that changed. By summer, even the New York Times and others began to realize that maybe transit's not as bad as we first told you it was. And then by February, we saw that California, which is the car capital of the United States, had the most deaths in the United States. So we set out to do a fairly comprehensive report interviewing virologists, epidemiologists, and I'm delighted Dr. Wu is joining us today, and he can add a lot to this. While I'm not a medical professional, I have a background in science and engineering, and we spoke to people from around the world that had done contact tracing on transit to really see if there was any kind of correlation. And what we found, whether it was Paris, Vienna, Tokyo, we have longer lists than this, Hong Kong, Seoul, Singapore, Milan, the answer was no. No clusters could be found on transit, that there seemed to be no correlation between transit use and outbreak of the virus. And in many of these cases, masks are mandatory. They're now mandatory in all these systems. So what we're speaking about are systems in which people are wearing masks. Next. And we looked at correlations over time. In New York, we saw a return of ridership into the millions per day. And during the same time, the report was issued in September. So on the left, you could see what we published in the report. You could see that the number of COVID-19 cases went down when transit went up. And if you look to the right, you could see no correlation between transit usage and outbreak of the virus. And in the next slide, you'll see we looked at many different cities around the United States and found the same thing. The ridership could be going down and COVID's going up. Ridership could go up and COVID's going down. You could see Hartford screen over here from March to July or so on that, and no correlation. And why would there be no correlation? And Dr. Wu could probably answer some of this, but what we found by interviewing virologists and epidemiologists, that one of the things they pointed out is that this is largely an airborne virus. Transmission is largely airborne. And people don't talk on transit for the most part. And that's pretty good because your mask can then capture a lot of those viral particles, or viral particles that get out don't travel very far. If you were singing on the subway, that's a different story. And then a lot of transit systems do have some airflow systems. Buses opening windows is terrific for that. Frequent door openings for short transit trips, short duration. And the formula by other medical professionals is that successful infection has to do with not only your exposure to the virus, but how long you're exposed to the virus. Next. So this is from Dr. Hitoshi Oshitani, a virologist at Tohoku University, who investigated with his team where these were clusters. They were gyms, pubs, live music venues, places where people gather to eat, drink, and chat, but did not trace any clusters to Japan's heavily packed commuter systems. Riders were usually alone, not talking, and wearing masks. While it's not impossible, he said, based on his the team's tracing, it must be rare. Next. And when we look at where the per capita cases are the highest, that's where people rely on cars. So and we're not going to make the same mistake by saying cars cause COVID. It's the ice cream example again. We're not going to do that. But if you look at the top 10, there's virtually no measurable transit ridership in the top 10 in the United States. As of February 11th, the New York metro area is actually 285th. And here in Connecticut, New Haven at 346 and 425. So while numbers are still high, you're doing much better than most of the country, even though you have greater transit ridership than most of the country, certainly much greater than the top 10, 4 times as great as the top 10 in most cases, or more than that. So the conclusion, it's not how you travel, but it's what you do at the end of your trip that affects the probability of contracting the virus. Next slide. And there are safety and health consequences if we abandon transit and people switch to private cars. The chart below shows the crash rate. You're 20 times more likely to be in a fatal crash in a car on a per mile basis than on a train, subway, bus, or far, far more than that on plane, not to mention additional pollution, inactivity, diseases, and acceleration of climate change. Next slide. And that concludes my presentation, and I look forward to hearing from the other panelists, and thank you.
Sam, thank you very much. We're going to be bringing you back here in just a couple of minutes, but first we are joined by one of the preeminent health experts here in our state. I'd like to welcome Dr. Ulysses Wu. He is the System Director of Infectious Disease, Chief Epidemiologist, and Chief Antimicrobial Steward at Hartford Healthcare. Does that fit in a business card, I wonder? Just kidding. As an infectious disease specialist, Dr. Wu has worked tirelessly over the past year fighting the COVID-19 pandemic, helping to lead the Hartford Healthcare team that keeps colleagues, patients, and families safe throughout the state of Connecticut. Dr. Wu is responsible for helping to prevent, diagnose, and treat a wide variety of infectious diseases, but during this last year, he has spent much of his time focused on the pandemic. And Dr. Wu, I'll give you the floor for a minute or two here, and then we'll jump into some questions for you. I'd like you to, if you could, just introduce yourself, tell us a little bit about yourself, and just fill us in on what health experts know about the public transit situation in terms of spreading COVID-19. Dr. Wu?
Thank you for having me on. I really appreciate the opportunity to talk to all of you, and I really appreciate the expertise. You did a great introduction of me, for me, and there's not much else to say. I guess I should say that it's bittersweet. For us, it's almost like our Super Bowl. We don't come across this in many generations, in many lifetimes, and it's been a very intense and fascinating experience. But given the amount of morbidity and mortality that has suffered from this, it's we take comfort in the fact that we've learned a lot about this disease. So, with regards to transit and the spread of COVID-19, so we talk about perception versus reality, and the perception is that public transportation has the perfect ingredients for super spreader events. So the perception is we got closed spaces, we got crowds, we got close contacts, we got people all up in each other's faces, and that this is the perfect milieu for spreading COVID-19. However, if you look at the flip side, and you look at, I love what Sam said about using cars and people using cars rather than public transportation. And so the journal PLOS One, the Public Library of Science One, they actually noted in November of last year, 2020, the decline in public transportation. And there's a problem with that because there's the tentative link of higher exposure of particulate matter that is being generated by all of the automobile usage. And so this particulate matter may have higher mortality rates, especially when it comes to COVID-19, and especially to the underserved communities that may rely on these for public transportation. Sam said he brought up all the great studies, and yeah, I agree with him. Contact tracing efforts in France, in Austria and Japan, they have failed to link any of these clusters to public transit. Even the American Public Transportation Association, the APTA, they published in September that their correlation has found very little correlation between the use of urban public transit and transmission of COVID-19. But the reality is that transportation, and Sam had mentioned airplanes in his presentation as well, it has certainly contributed, not the airplane itself, but it has contributed to the spread of coronavirus. You all probably remember all the horror science fiction movies, such as Contagion. And all it takes is 2 seconds from something to come from overseas to here. And so transportation in itself is responsible for the spread, but public transportation by itself is not responsible for spread within the transportation itself.
Dr. Wu, thank you very much. Let's roll up our sleeves a little bit and talk about ride sharing and public transit, because it is such a big part of life here in Connecticut, particularly corporate life. A lot of people do double up in the cars. A lot of people take the buses and the trains, Metro North and so forth. How can we go on a train right now or a bus right now and feel safe?
I think it goes back to perception versus reality. And so the perception is, oh my goodness, it's not safe. But the reality, the science out there supports that this is likely to be safe. I believe that we can safely ride as long as we follow certain rules. And I don't think that these health and safety rules are going to change from now till the summer or to the winter. These health and safety rules should maintain in place. I can talk about some of those safety rules, but for example, for all transportation, right now, masking is essential. Obviously, effective February 2nd, 2021, the mandate masks are required on planes, buses, and trains, all form of public transportation. So with masking, we can also consider double masking. Some of the other principles, we want to practice physical distancing. Now, I know that may be difficult, especially at peak hours, but when it isn't peak hours or there is the possibility to do physical distancing, I think that is one of the options. Practice hand hygiene and avoid touching your face. I think I probably touched my face like 5 times already in this segment, but it's almost something that we do subconsciously. And obviously, if you're sick, you want to stay home. For public transit, I mentioned that you may want to consider traveling during non-peak hours. For some people, that's not an option, obviously. With buses, you want to enter and exit possibly through the rear entry door. Again, don't touch surfaces, and anything that causes you to take off your mask, such as eating or drinking, may be very important. And so there are a few factors that may help with this. If you spend less time in transit, you can certainly safely transit, and you're not engaging in activities during public transit that Sam had already mentioned to. You're not talking, you're not singing, you're not shouting at this time.
Yeah. Based on what we're seeing and what you've been able to learn, who is most affected by COVID-19 and how might that translate into the use of transit? So I guess another way to put this, Dr. Wu, is who shouldn't be going on public transportation right now?
Well, that's a very good question. And it's a difficult one to answer because there are some people who they have no alternative, but they need to use public transportation. So the way I look at it is not necessarily who shouldn't be on public transportation or who shouldn't utilize it, but look at the people who may be at increased risk for complications from coronavirus. And so, for example, we know that the immunosuppressed, people who are undergoing active chemotherapy, people who are on high dose steroids for long periods of time, pregnant, the pregnant population. These are people who may be at higher risk, cardiovascular disease, diabetes, and so on and so on. So they're at higher risk, so they should try to take as many precautions as possible when they're, if they need to use public transportation.
All right. Are we seeing any difference in the spread of COVID-19 in certain areas based on their density? For example, is it higher in places where people use public transportation or in the suburbs where people necessarily don't?
Yes, we looked at exactly that. And in fact, it's not density at all. So Manhattan is the densest of all, and in the entire metropolitan region, south of, let's say, Harlem has among the lowest incidents. It has to do with household density. So if it's two people in a house and it's a apartment and it's a high apartment building, that's not demonstrating any great communicable diseases here. You're not getting it riding up and down the elevators in that. But in homes that have 6, 8 people, you're seeing far more. The suburbs, the rates in the suburbs are actually higher than the rates in New York City. And in New York City, the rates in Staten Island, which is our most car-oriented borough, are higher than they are in Brooklyn or even the Bronx.
Dr. Wu, we've just heard from Sam about his belief about COVID rates in more dense areas. What are you finding?
I agree with everything that Sam had said. It has nothing to do with density of public transportation. It has everything to do with density of population. And with density of population, you will have more clusters and you will have more crowding. Unfortunately, as has been discussed, we've talked about the health inequity as well as the underserved populations who sometimes tend to reside in denser population areas and also have maybe less access to care. And that is part of the education and the responsibility to try to reduce the spread in some of these areas. But it has nothing to do with the density of railway, or I should say public transportation.
I have a final question for Dr. Wu, and that is these new strains of the virus. Should people be concerned about them as they step onto a bus or a train or a plane?
I don't think so at this time. I mean, there's a lot of science that needs to be borne out about these variants. And I do believe variants have been circulating since last March. And that's just normal. What happens with viruses when they replicate, there will be mutations. We are keeping a close eye on the variants, but it doesn't change how we approach public transportation. We're still going to do the same things that we're going to do. We're still going to practice hand hygiene. We're still going to mask. We're still going to do social distancing. So science still needs to be borne out on it, but we shouldn't change anything we do at this point.
Dr. Wu, I remember one quick thing. When I first met you, I noticed that you didn't shake hands. Is that something that you still believe we should not be doing?
So Sam stole my thunder on this. I'm going to be wearing a mask and not shaking hands now.
Okay.
It all has to deal with transmission at this point. Sure. And I haven't gotten a cold, knock on wood, this year either. Influenza, okay. We've had in our health system, maybe just 2 cases in influenza when we should be having thousands at this point. So it makes a difference.
Dr. Wu, we thank you so much for your unique insight on this, and it's always great interviewing you. Thanks for being with us here today. And thanks to all of your colleagues who, of course, worked tirelessly for all of us this past year. Well, now that we've heard from Sam about the relationship between the virus and transit and have received some insight about how health experts view the situation, let's turn to what we are doing here in Connecticut to use the best practices to protect all of those who use public transportation. Here to let us know what the Connecticut Department of Transportation is doing to make riding transit as safe as possible is Rich Andreski. He is the chief of the Bureau of Public Transportation at the Connecticut Department of Transportation. He is a highly experienced public transportation professional, spending 17 years with the New Jersey Transit, New Jersey's statewide transit agency, where he held positions of all sorts of responsibilities, including chief of staff for rail operations and director for Trans-Hudson project planning, which joined the Connecticut DOT in 2015. And Rich, could you start, first of all, thanks for being with us here today. And I wanted to start just a little bit about the public transportation system here in Connecticut and how you've been responding to the COVID-19 pandemic.
Dennis, thank you. It's a pleasure to be with you today. To start off, let me just give you a quick perspective on the Connecticut public transportation system, which is quite extensive. The The Connecticut DOT is responsible for the operation, development, and care of that statewide system, one that serves about 80 million passengers each year. Our passenger rail system includes services operated under the CT Rail brand. You may know those lines as Hartford Line and Shoreline East. We also work very closely with Metro North Railroad to provide service on the New Haven line, New Canaan line, Danbury line, and Waterbury line. Prior to COVID, we had about 40 million passenger trips on those 6 rail lines. Now, on the bus side, we also have a statewide bus system. Many of those bus services are known as CT Transit, and that includes local and express bus services, as well as a gem of a bus rapid transit system. We call that CT Fast Track, and that service operates between New Britain and downtown Hartford. We also have transit districts in Connecticut that also serve urban and rural communities, and all of those bus services combined provide or serve 38 million trips annually. So our bus system in Connecticut is roughly equivalent to our rail system, although many don't know that. Now, there is an important difference in how the bus and rail systems have performed during COVID. We heard from Sam Schwartz earlier about those differences in ridership patterns. And there's some unique challenges in terms of how we keep our public and our frontline workers safe. Our rail system historically has served commuters. Many of them work in New York City, and many of those individuals have shifted to telework, remote work. They are no longer commuting on most days, if at all. Our bus system in Connecticut tends to serve individuals who rely on public bus service for almost every trip they make throughout the day. Many of them are using that service to commute to a job, to a medical appointment, to school, to participate in the everyday, activities of their community. And these riders are often minority and low-income individuals. They are the essential workers of our communities, and they often do not have the luxury of staying at home and working remotely. So the question that we're focused on today is, or I guess the question on everyone's mind is how is public transportation safe? I would start with Sam's data. Pretty fantastic. It's pretty clear that public transportation does not appear to be a risk factor in and of itself for contracting COVID. But we're not, taking that lightly. We're still taking this pandemic very seriously. And we've taken a number of measures throughout the last year to keep the public and those frontline workers safe. And I'll go through a couple of those right now. The measures are, about keeping people safe, both on board our services, as well as when and where they're waiting for service. And I have to tell you, we're being guided by the science and the guidance offered by the Centers for Disease Control. We're not making this up at the DOT. We're relying on the experts, like Dr. Wu, in terms of how we proceed. So at the beginning of the pandemic, we focused on things like contact transmission. Remember, in the early days, we weren't wearing masks. We were focused on things like suspending cash fares, so we didn't have crews and the public interacting with each other. We moved to rear door boarding on buses to keep the public away from bus drivers. We accelerated the installation of driver doors, office doors, we call them. They're driver barriers. They're clear glass partitions between the public and the drivers. And we distributed masks. We focused again on intensive cleaning of vehicles and stations. And I would argue the most important thing we've done is to keep full service in place on our bus system. Many places in the country were curtailing service levels, and we felt it was important to continue to offer full service. Even though ridership was down, we wanted to maximize room on board service for people to spread out and to maintain that social distancing. But as we all know now, this is an airborne disease. It is contracted through the air. And so we've redoubled our efforts in terms of how do we ensure the best possible outcomes for users of public transportation. We reached out to Yale University. They couldn't have been more helpful in understanding how air is exchanged on board our vehicles. We learned that, for example, on our rail cars, air is exchanged every 6 minutes. So every 6 minutes, the interior air of that coach is replaced with fresh exterior air, which means that if the virus is present, it's being expunged from those rail cars rather frequently. We learned also that it's important for crew members and the public not to stand or dwell near the air intakes, remembering that there's these intakes inside the coach, and we don't want individuals standing near that air intake to minimize the potential for spread. We looked at also upgrading the air ventilation systems. Could we go with a higher filtration system to filter out the viral particles? And so we learned quite a bit with that Yale partnership. We also initiated mask days when the guidance changed and there was recommendations to wear masks. We worked to go out and distribute masks in the communities and onboard the services, the buses and trains. We even got Governor Lamont and Lieutenant Governor Bisowitz to join DOT staff. It was fantastic. We were downtown Hartford, downtown New Haven, and other locations. And we're trying to be a little innovative here too. We've partnered, and thanks to CT Rides, we were able to get Connecticut sports teams and universities to lend us their mascots to do some public service announcements, which are going to drop this week on YouTube. So stay tuned and check out those mascot videos, which promote wearing of masks on public transportation. Pretty cool. So I could go on and on here, but those are some of the highlights of what we've been doing at the DOT.
That's going to be really fun to see, that mascot mask thing. I love that. Great idea. Rich, give us a sense of the role that public transportation played at the beginning of the pandemic and perhaps still plays to this day.
Yeah, I think everyone may be jumping to a conclusion that sort of what is the future of public transportation? I got to tell you, although ridership is down, the people that are still riding our buses and trains are absolutely doing it because they have. First of all, they're in all likelihood essential workers. The role has been incredibly important. I can tell you, we serve a number of Amazon fulfillment centers in Connecticut. And those Amazon fulfillment centers have never been busier, right? We all know the packages are popping up on everyone's doorstep. Folks are turning to e-commerce. Those types of services can't exist without those essential workers who happen to be riding our public transportation system. So although we'd like to measure our success in raw numbers, I would argue during the pandemic, we really need to look at who's using those services. And so while overall ridership is down, the people that are using it are absolutely, they have no other way of getting around.
All right, gentlemen, thank you very much. I want to get us all together and talk about a number of issues that we are still facing to this day. And of course, vaccines are in the news. Dr. Wu, I'll begin with you on this one because there's a belief out there, you get your COVID vaccine, you're invincible, you can go anywhere, you can touch anything, you can do crazy things like Will Ferrell did on Elf, picking up things off the ground and all that. But that's not really true, is it?
No, unfortunately, it is not true. The vaccine, it's not a passport to immunity. There are many different factors that go into infectivity and whether or not one gets infected. A vaccine is wonderful and certainly reduces your risk and your chances for getting it, but it doesn't mean that you cannot acquire it. And it also doesn't mean absolutely that you cannot be a carrier and give it to other people. So yes, we should not be Will Ferrelling, if that's even a word, our vaccines.
Yeah, I like that term. And Sam, I'll ask you this. So in terms of, we've heard that perhaps down the road, maybe some organizations, airlines and stuff may want to have a certificate of vaccination before you are allowed to do certain things as we go forward. How do you think vaccinations will play in terms of who goes on public transportation and who does not?
Yeah, I think it's going to play a big role. I think once people get the vaccine, and as long as they're smart and they wear masks, and you should wait 2 weeks after you got your second vaccine, people will feel far more comfortable traveling. In fact, I just got my second vaccine, and I am planning a trip to get out of the cold in the Northeast. So we're going to see more and more people returning to public transportation as they feel more and more comfortable having gotten the vaccine. But be smart. Even if you have the vaccine, wear the mask, wear 2 masks.
Rich, this is certainly a great venue to tell people about the pros and cons and the facts and the myths about COVID-19 and public transportation, but how do you get the word out there to the masses that it's okay to get on a bus, it's okay to jump in a plane, it's okay to get in a, do public transit, go back to the old days?
Well, I think today's program is one way in which we do that. Putting the information out there, talking about what it is we're doing at the DOT to keep people safe. I do think there's a combination of factors. One is communication. I think the rollout of the vaccine is also critical. And then, a reason to travel. Remembering many of our riders aren't traveling because they're working remotely. So until those jobs reemerge and people start to go back into New York City, I think there's only so much we can do to get people back on the trains, right? If they don't have a reason to travel, they're not going to come out and ride.
We talked about this a little bit earlier in the program, but as more and more people get vaccinated, do you see some of these mandates perhaps falling by the wayside? Maybe masks everywhere, social distancing, things like that? Anyone can take this who'd like to.
I can start with that. I do eventually see the mandates going away, but I don't foresee it in the near future at this point. We do have to achieve some level of herd immunity. There is the issue of the variants out there as well. As Sam and I have attested to, the masking and staying away from people have kept us healthy so far this year. So I don't foresee it going away anytime soon, but we shall see.
Dr. Wu, just a couple of tips for travelers out there as you enter a bus or you prepare to take a flight, things like that. What kind of things should you do? Obviously, you need a mask. Should you double mask? Should you bring sanitizer? What should you do?
You should do all of those things. So, actually, when it comes to double masking, it's funny because the CDC released that study, and it really didn't have to do with double masking. It wasn't about necessarily reducing the penetration. It had to all do with fit, and that's what's important about it. They looked at cloth masks over surgical masks. And so double masking is important, but not because of penetration, but more so because you want to improve the fit. And yes, you do want to, if you touch surfaces, you want to use hand hygiene, you want a social distance. It's going to be the same going forward.
There are some people who like the plexiglass dividers in restaurants, and there are some changes to public transportation. Sam, what kind of changes came about during the pandemic to public transportation that you think that might be here forever because people just like them?
Yeah, I think the barriers, I don't think we'll see the barriers that are protecting the bus drivers go away in the future. I think that there's lots of reasons for doing that. One is the pandemic, but also the safety of the drivers in altercations. I think the cleaning routine will be above what it was prior to the pandemic, but not quite as high. It looks like some people are calling that hygiene theater. I think we may have been overdoing it, but it's because we didn't have the science yet that this is more airborne than contracted by touching objects.
But the capacity on some of these transportation devices, let's say a train or something like that, is lower right now. Do you foresee that going back to normal, or perhaps will systems just need to add more cars and more trains?
Yeah, well, Connecticut, and listening to Rich, it sounds like Connecticut is doing the right thing. And not every state or city is doing that, and they're maintaining the full schedule. And that's what I like to hear, because transit will come back. It will take some years, but it is important. And there's a pretty hefty amount of funding for public transportation that's coming out of the Biden administration in the COVID bill. And I believe there will also be in a public transportation as part of an infrastructure bill.
Rich, let's talk a little bit about the risks that public transportation could face if people continue to avoid it.
It's a great question. The risk is substantial. Failure is not an option for public transportation. I would start with the 3 E's that come to mind: equity, the environment, and economic development. So, on equity, we have individuals that rely on public transportation to participate in the very life of their community, to reach access to employment opportunities. We can't let them down. We're going to have to figure out how to sustain the system. The environment, there's increasing focus on climate change and the damage and the threat that climate change poses, and public transportation is part of that solution. And we're going to need that system as we go forward. And then economic development. We coming out of this pandemic are going to want to see a resurgent economy. Public transportation is what people are looking for. Developers, people, residents that are moving into communities, they want to know where the local bus or train service is. And so I think for those three reasons, equity, the environment, and economic development, we've got to find a way to sustain our public transportation system.
So I want to end on a positive note. I'll throw it out there. What kind of optimism are you each feeling for life in terms of transit in the post-pandemic world? I'll begin with you, Rich.
Life will never be the same for all of us, but I do think that human nature is to be social. So the reason for optimism is that we are all craving interaction. And, life may not be the same in terms of going to the job, going to the office 5 days a week, but people will get out and about. They're going to want to go out to eat. They're going to want to go to see a show in New York, take in a game. I think our economy will rebound very strongly. And so, the future of public transportation depends on people going about their lives and participating in their community. And I feel very hopeful about that.
Dr. Wu, are you optimistic about post-pandemic world?
I am optimistic, and I'm more optimistic in the lessons that we have learned from this. Human nature is to be social, and unfortunately, human nature is also to have a short memory sometimes. And we had the Spanish flu a century ago, and a lot of that could be extrapolated towards now, and we've forgotten a lot of those things. So I'm hoping that we've learned a lot about this disease, and that we take these points and continue to go forward with them. But I am optimistic.
Sam, you've seen a lot in public transportation. How optimistic are you for what is ahead for public transportation once the pandemic is over?
I'm very optimistic, and I go back to 9/11. I lived across from the World Trade Center, and I also worked down there, and I worked on the restoration. And I recall people saying to me just a few months after the towers came down, I was working on the plan for the future World Trade Center. And at that time, people said, why are you talking about tall buildings there? People will never go back to the World Trade Center, and let alone work on the 50th floor, 60th floor or more. And prior to the pandemic, One World Trade Center and all the other buildings were well over 90% occupied. So I'm very optimistic. This will be history for many of the people in the future.
I want to thank our amazing panel. You three are very smart people who know a lot about COVID-19 and public transportation. I think you've really helped a lot of people. And I encourage all of you who are watching this webinar to spread the good word that you did learn today. So I want to thank Dr. Ulysses Wu from Hartford Healthcare, Sam Schwartz of Sam Schwartz Consulting, and Rich Andreski from the Department of Transportation. Thanks to all three of you for your great and valuable insight today. I also want to thank today's event partners as well: the Greater New Haven Chamber of Commerce, the Northwest Connecticut Chamber of Commerce, the Waterbury Regional Chamber of Commerce, the Middlesex County Chamber of Commerce, the Metro Hartford Alliance, CBIA, and CT SHRM. And I invite you to stay tuned to CT Rides, the Hartford Business Journal, and New Haven Biz for future segments of Connecticut in Motion. We will cover subjects such as the future of working arrangements. We're all dealing with all sorts of things from home to office sharing, its impact on commuting, the economic impact, and more. And lots of stuff to talk about as this pandemic continues to grip our state, but there is light at the end of the tunnel, and that's a great thing. I'm Dennis House on behalf of CT Rides and the Connecticut Department of Transportation. Let us keep our state moving forward. Thanks, everybody. Have a great day.